Hello, my name is Janet Vanderlock, and I am Matt's mom, advocate, and voice. And I have an adult son. His name is Matt. He's 27. He was diagnosed with chronic paranoid schizophrenic in 2014. He's been in the judicial system, low-level offenses. He did have some felonies, but they were dismissed due to competency. And right now he's actually sitting in jail. Friday is his 28th day. That will be the 28th mark, waiting for a competency evaluation. Prior to that, he had spent 84 days languishing in jail for waiting for a bed. And until I reached out to Representative Jonathan Singer and the Colorado Disability Law Center, I was able to get him a bed for competency restoration, which restoration to me is just another word for just having them recite what they're being. It's not even, they don't get restored. They still come out sick, right? So it's just another day, another form of collecting money, because it's $667 per day that they stay every time, per day per inmate at the mental hospital in Colorado. So why did it take 5 months for them to restore him? I mean, these are the issues that and questions and concerns that I have. Right now, the last year he was on mental health holds for 8 different times. When he did come out of the state hospital, he was released in January of 2018. And when they released him into, or this is one of the times that they released him back to jail. And when they released him from jail, they dismissed all the charges, but when they released him from jail, he didn't have a bridge prescription, no resources. He lives with us. I had to take him to my primary care physician to get a 30-day bridge prescription. He was court certified in December of 2018 on a 6-month court certified gravely disabled for 6 months through MHCD. MHCD dropped him, which is the biggest contradiction ever. How do you drop somebody who's gravely disabled? How do you deny someone services like that? He also was denied services because when he did come out of Pueblo, the intake coordinator at MHCD told me that he can't get services because they're waiting on what the pending charges are from his probation officer. He just came out of the state hospital, and you are waiting on what the charges are to get services. So we're leaving out a huge vulnerable population that we're not treating, which is the gravely disabled and the severely mentally disabled. It takes 4 to 6 weeks just to get an intake. And my son has to do that, which intellectually he's not capable of doing. And they told me that it's because of HIPAA laws, but then how come I can make an appointment for my husband at the dentist or his family physician, but I can't make an appointment for my son? That to me needs to be changed. And we need to remove mental health reentry programs out of the jail system, because this is what happens when you pair jail, police with mental health services. This is what happened at the RISE program at Arapahoe Detention Center. They released him from, this is another stay. This is the first stay. He was at Pueblo for 5 months. They released him. They had already dismissed the charges, but yet they still sent him to jail at Arapahoe County in the RISE program. And I got a call from the director, Wallerstein, saying that my son was on a mental health hold for suicide watch. They said he did this to himself on a 24-hour watch, 15-minute check-ins. My son didn't do this to himself. His MO isn't suicide. It's chronic paranoid schizophrenic. So that's one thing that we need to do. Second of all, the intakes at MHCD, why are they taking so long? Why is it 4 weeks? That's just for the intake. And then an additional 2 to 4 weeks just to get seen. And then 90, if you miss your appointment or you don't have contact with your case manager for 90 days, then they drop you. Why? Why are they doing this? That's my question. And MHCD has their hands in all kinds, they're a nonprofit, so they get tons of funding, and they have their hands in all these pilot programs, right? But what are they doing? Why can't they consolidate those programs and use that money for what it's intended for, to help the severely disabled and the gravely disabled? And why did they, there's 455 beds in the Pueblo State Hospital, right? So that's supposed to cover the whole state of Colorado? Why? But yet MHCD keeps getting funding and funding and funding. Fort Logan dropped from 222 beds to 94. Why aren't they using that funding to increase those beds? Those are the issues that I'm having with MHCD. He did have a great case manager. Her name was Hannah DeGroat, but the policies that prevent her to provide services don't allow her to do what she's supposed to be doing. So my son right now is sitting there waiting on a competency evaluation, and I spoke to Dr. Rye in the past, and he said that there's 300 inmates per one nurse. Does that seem right to you? I mean, our jails are the #1 mental health service provider right now. People with mental illness spend
300 to 1 at the state hospital.
No,
or
at the city jail.
Got it. Thank you.
And
you have 30 seconds.
okay, it's inmates that have mental illness spend 5 times longer in jail than your average inmate. So we really need to figure out how we can do better. And thank you very much.